Hi, I'm Dr. Gil Welch. In this Less Medicine, More Health short take, we'll consider the heterogeneity of cancer. It turns out there's a lot of variability in what we call cancer. It's like a bunch of different animals behaving in very different ways. The heterogeneity of cancer is relevant to assumption number 3. Sooner is always better. We've all been taught that early detection is the best way to deal with a feared disease like cancer. You know it. Early detection saves lives. You're probably most familiar with this message in terms of breast cancer screening. Early detection saved my life. But it also comes up in skin cancer screening, along with some impressive statistics, and lung cancer screening with more impressive statistics. It even comes up in oral cancer screening, where early detection through regular oral cancer screening saves lives. Whenever you see these persuasive messages about early cancer detection, you should ask yourself 3 questions. First, are the statistics misleading? It turns out that survival statistics are biased by both lead time and overdiagnosis. These are important topics that are covered in separate videos if you want to learn more. Second, does early detection really save lives? Here I'm alluding to cancer-specific versus all-cause mortality, and if you've read the chapter, you already know what I'm talking about. And then finally, do all cancers benefit from early detection? That speaks directly to the question of the heterogeneity of cancer. And it turns out that some cannot be found early, and others are better off not found. We need to think about the word cancer differently. Our understanding of cancer is changing. And we now realize that not all the cellular abnormalities labeled cancer will ultimately matter to the patient. Consider what's been called the barnyard pen of cancers. There are 3 animals in the barnyard: the birds, the rabbits, and the turtles. And the goal of early detection is to fence them in, catch them early. Of course, you can't fence in a bird. The bird's already flown away. The birds represent the most aggressive cancers, the cancers that have already spread by the time they're detectable. The rabbits are hopping around, and if you build enough fences, you can catch them. And the rabbits represent the more slowly growing cancers where screening will arguably have its most beneficial effect. And then there are the turtles. The turtles aren't going anywhere anyway. And the unfortunate reality is that screening's very good at finding turtles, yet none of us would want to be treated for cancer that was never going to bother us. Here's an article from Life magazine entitled "The Plea Against the Blind Fear of Cancer," written by Dr. George Kreil at the Cleveland Clinic. Let me share with you one paragraph. In clinical practice, to say that a person has cancer gives us little information about the possible course of his disease, as to say he has an infection. There are dangerous infections that may be fatal, and there are harmless infections that are self-limited or may disappear. The same is true of cancers. Cancer is not a single entity. It is a broad spectrum of diseases related to each other only in name. Some of you have never heard of Life magazine. It hasn't been published in years. And you'll recognize that the black and white photographs means it must be very old. It is. It was written the year I was born, 1955. Dr. Kreil probably is the originator of the barnyard pen of cancers. Let's consider the heterogeneity of cancer progression in a graphical form. On the y-axis, I'll put the size of the cancer, and I'll say cancer starts with an abnormal cell, even though, of course, it starts in the DNA. A cancer may grow large enough to cause symptoms, and it may go on to grow large enough to cause death. On the x-axis, I'll consider time, which is bounded by the point at which people die from something else, death from other causes. And now we have a framework to consider the heterogeneity of cancer progression. That's a fast-growing cancer. starts as an abnormal cell, quickly goes on to cause symptoms, and quickly goes on to cause death. This is a slowly growing cancer. It grows slowly, but goes on to cause symptoms and to cause death. Which arrow is more likely to be detected by screening? Well, there isn't much time to find a fast-growing cancer. And in fact, fast-growing cancers often appear in the interval between screening tests. There's a lot of time to find slowly growing cancers. Thus, screening disproportionately detects more slowly growing cancers. But that's not all the heterogeneity. There's more. There are cancers that are growing very slowly. They are in fact growing, but they grow so slowly that they never have a chance to cause symptoms before the patient dies from other causes. And then there are pathologic abnormalities that meet the definition of cancer, but in fact don't grow. They're non-progressive, or they regress. Now, how does this relate to the barnyard pen of cancers? The fast-growing cancers, they're the birds. The slow-growing cancers, they are the rabbits. And the very slow, non-progressive, or cancers that regress, they're the turtles. And overdiagnosis is detecting the turtles. It's an uncomfortable reality. There are a lot of turtles out there. We know this from autopsy studies, studies in which people undergo autopsies after having died from some cause other than cancer. Nonetheless, 1 to 3% of adults harbor unsuspected kidney cancers. At least a third of adults harbor small thyroid cancers. About a third of women aged 40 to 49 harbor small breast cancers. And over half of men over age 60 harbor small prostate cancers. These data should lead you to wonder, how hard should we look for small cancers? Because they're common. I want to come back to this graphic and offer a slightly more comprehensive view and add one more dimension, namely that of developing metastasis, which is the hallmark of cancer, the ability to spread to distant sites, and in fact is the most common cause of cancer death. There are lots of abnormal cells. Every once in a while, one takes off. Those are the birds, very rapidly growing cancers. Some take off more slowly. Those are the rabbits. And then some may grow and then regress as the body recognizes them and deals with them, or as they outgrow their blood supply. That's a lot of heterogeneity. There's a lot of possibilities in what is now currently labeled cancer. We need to think about the word cancer differently. Some will be systemic at the outset. Some will progress. Others will not. It's the birds, the rabbits, and the turtles. So I want you to think a little differently when you see a headline like this. Molecular breast imaging nearly quadruples detection for breast cancer. 4 times more breast cancer. We hear that and we think that's a good thing. Or is it simply detecting more turtles? The assumption is sooner is always better. While early diagnosis may make sense in selected settings, its widespread adoption has been a recipe for making people sick. Because of the heterogeneity of cancer, the disturbing truth is that early diagnosis can needlessly turn people into patients. Remember, that's because of turtles. I hope this helps. Thanks.